Hello, everyone, and welcome to episode 1 in our multi-segment series, Physical Therapy 101, the who, what, where, why, when, and hows of PT. In episode 1, we're simply going to define physical therapy, define physical therapists, and then hopefully by the end, you'll have a better understanding of how physical therapy can help and benefit you in doing the things you need, want, and love to do. In our intro, we established that many people don't know what physical therapy is, and that only roughly 10% of adults with musculoskeletal injuries actually even seek out the services of outpatient physical therapy. And that's unfortunate because as a physical therapist, I know that physical therapy can help anyone that needs to move. So, to improve this, we're going to do some educating because I've always believed that knowledge is power. Let's begin. When we're looking to find the definition for something, it's typical to go to a dictionary. So we're going to head to the Merriam-Webster dictionary to get a definition of physical therapy. And then we'll head over to the APTA, the American Physical Therapy Association, which is the national lobbying board for PTs in the US, and we'll get their definition of a physical therapist. According to the Merriam-Webster dictionary, the definition of physical therapy is therapy for the preservation, enhancement, or restoration of movement and physical function, impaired or threatened by disease, injury, or disability, that utilizes therapeutic exercise, physical modalities such as massage and electrotherapy, assistive devices, and patient education and training, called also physiotherapy. That's important because in the US, we call it physical therapy, and clinicians are physical therapists or physical therapy assistants. But in much of the rest of the world, it's referred to as physiotherapy, and clinicians are physiotherapists, also known as physios. Now, according to the APTA, physical therapists, or PTs, are movement experts who optimize quality of life through prescribed exercise, hands-on care, and patient education. Physical therapists teach patients how to prevent or manage their condition so that they'll achieve long-term health benefits. PTs examine each individual and develop a plan using treatment techniques to promote the ability to move, reduce pain, restore function, and prevent disability. In addition, PTs work with individuals to prevent the loss of mobility before it occurs by developing fitness and wellness-oriented programs for healthier and more active lifestyles. The key points here are physical therapists are human movement experts. So if we're dealing with movement and function, if you're healthy and you have it, then we help you keep it or improve it. If you're injured or disabled and you don't have it, then we help you get it back. More importantly, physical therapists are focused on prevention in an effort to stop or minimize the risk of future pain and injury through education and different fitness and wellness-related initiatives. Now, not everyone does well with wordy definitions, and many people are visual learners. So let me give you a visual definition of physical therapy. I want you to envision a neuromuscular or a musculoskeletal detective. Now, everyone's familiar with detectives. They solve mysteries. They go to the scene of the crime. They gather clues, facts, data, evidence, and other information. Then they leave the scene of the crime and go out into the bigger world to examine all of the other suspects before they can come to a conclusion or a solution to the mystery. Physical therapists do the exact same thing, just with the human body. If somebody has a question, concern, ache, or pain, a physical therapist will examine, evaluate, and assess locally, but then they have to look at the bigger picture and the parts above and below, looking at things like posture, motion, strength, flexibility, and overall movement patterns to help get to the root cause of a person's specific issue or complaint. It's really that simple. And then a physical therapist will offer up an individualized and customized treatment approach, as well as tips, tricks, techniques, ideas, strategies, and education to help meet your specific needs. So, as we wrap up, what are the things I need you to know? Humans, from our first to our last breath, are designed to move in order to function and do those things that we need, want, or love to do in everyday life, whether that's at home, school, at work, for fun, sport, fitness, or even recreation. It's those little things like being able to lift or carry your son, daughter, or grandchild, expressing yourself through dance, playing a musical instrument, or creating some artwork, relieving some stress by going to the gym or heading out for a walk or run with a group of friends, or maybe just even engaging in some competitive or recreational sports play. It's those little things that make life exciting and worthwhile. So maybe you're doing well, you're healthy, and you want to stay that way, or you have a few questions, or maybe you're even getting some aches, pains. Worst case scenario, you even have an injury or some type of disability. Regardless of where you are in that entire spectrum, we've already established that physical therapists are human movement experts. And let's face it, we all want the best in life. So, if we have an issue with movement and we want the best, then it just makes sense that that number one go-to movement professional that you seek out for any non-life-threatening movement issue or complaint should be a physical therapist. Because ultimately, a physical therapist's goal is to keep you safe, healthy, and happy so that you can move and function effectively for an entire lifetime. As we conclude, I hope that you now understand what physical therapy is, what a physical therapist does, but more importantly, how physical therapy can help you to lead your most quality life at any age. Thanks for watching. Questions and constructive feedback are always welcome below. If you liked our content and found it useful, please take a moment to like and share it with others so that we can continue to reach a wider community of people. And stay tuned for episode 2 in the Physical Therapy 101 series, as we address why physical therapists are movement experts by going into greater depth about the rigorous educational and licensure requirements that a physical therapist has. We'll see you soon in episode 2.